Hi everybody, Dr. Cespedes here. It is our second video. I'm very excited for this. Last video I talked a little bit about what counseling is, the process of it, what it looks like. Today's video, I wanted to get a little bit more into the meat and potatoes of what theory is. So last time we were talking about the counseling relationship and that really being at the heart, the crux of what we do as therapists. That no matter what theory you use, what style, what modality, at the end of the day, how strong the bond and the connection, the resiliency of the therapeutic relationship is what is known to be the most effective factor. Of course, as therapists and counselors, psychologists, whatever mental health professional that you are or that you may be seeing, we all tend to approach therapy a little bit differently. And it's a reason why when you look at one therapist and go over their profile, they may be the expert in existential theory. You may look at another and they're the expert in systems theory or working with families and couples. Even when you have a therapist who shares the same theory with another, there can be some big differences in there. And why is that? Well, simply putting it, that your theory is also part of your personality as a therapist. This is something that I really enjoy talking to a lot of students about, particularly counselors in training who are learning more about what theory they feel more drawn to, which ones they're curious about, perhaps which ones they don't like. We're going to talk about one today that a lot of people have some issues with just because it's a bit dated. But it is the foundation of our field of psychoanalytic theory. And one piece of feedback I always give to my students is that you want to lean into a theory, not only that you're curious about, but one that you feel aligns strongly with your person, with your strengths, with your curiosities, with how you think about the world. A lot of the theories that you'll learn about, that we will learn about together, are created from individuals who they themselves greatly identified with their theory personally. It's similar to the common trope we see in research, that research is me search, that researchers who spend their life dedicated to examining a phenomenon of some kind of illness or theory, it's probably because they themselves have had some kind of emotional or mental or physical tie to that experience or a similar one in the past. And so if you're a counselor in training, I would encourage you especially to consider the parts of you, not only as we go through the different theories and the different opportunities, the different options, dive into the literature yourself, because I find that it's one thing to like a theory, to read it and feel inspired by it, but it's a whole other to put it into practice. And a lot of these foundational people in our field that created these different theories identify them as more than just a theory, but rather a philosophy for navigating life. That the theories you will learn, the theories that you will endorse as a counselor, therapist, psychologist, mental health professional, are going to shape not only how you show up with your client, but further shape how you see the world, how you conceptualize trauma, how you give feedback to a client based on their personality profile, based on their family of origin, based on their cultural components, based on the state of the world, right? So there's so many intricate ways to navigate therapy. And I think that's where I find it very overwhelming, but in the best way, is that there is no one size fits all model when it comes to choosing a theory. It's just important to choose one. And it's actually imperative that you choose one, because if you don't have a theory, then you're literally just like shooting the bull with a person who's coming to see you, and your feedback, your thoughts that you share in a session will not have any structure. So no matter what theory you choose, the structure of therapy stays pretty consistent. We start We express our intentions, our identity, who we are. Perhaps this is already done in a consultation fashion. And then furthermore, when you start working together and formally sit down, hopefully your billing procedures, nitty gritty, informed consent things have already taken place. I actually have some old videos on my channel that go into how to have an effective informed consent. So check that out if you're interested. And those of you who are current counselors, or I'm sorry, who are current clients, and your therapist didn't do that, be sure to check in with them on it, because it's just good standard of practice to know what you're getting into before you get into it. And there, of course, should be paperwork that identifies it as such and outlines it for you too. And so theory, like we said earlier, it's more than just a way, it's more than just a template of how to do therapy. Some therapies are more manualized than others. I've got a big old DBT manual over there that's highly manualized. There's a regime when it comes to the structure of it, whereas others tend to be more open-ended. They tend to be less manualized, more focused on the process versus the content of things. Some are more skills-based, whereas others are more process-oriented. And we'll talk about all of those. And based on your personality, you will align more with one over the other. For individuals who are drawn to a few different theories, fear not. Most of us in the counseling arena are not purists, meaning we do not purely operate from only one modality, but rather an integration of a few different ones. Notice I said a few, not several. I think a lot of counselors tend to identify as specializing in multiple different theories. They are the expert in the integration of person-centered, psychodynamic, narrative, DBT, CBT, ACT. They're the expert in everything. And I usually look at those profiles with a grain of salt, and just with a little bit of curiosity, because it is common to be an expert or to specialize in, I would say, maybe 1 to 3 theories, but only if they're all kind of within the same cluster or complementary. For example, there are some theories, and we're going to break them down specifically based on sort of their emphasis. And there's really 3, so pretty easy to remember. But there's 3 kinds of theories based on process and what you really hone in on that matter. One of them is more of a skills-based cognitive profile, whereas another may be more focused on goal setting, right? And come to think of it, that may be an effective match, where you may be highly skills-based as a client, or as a counselor. You may have a preference for using skills to practice, emotions and related things, managing related challenges, but you may also prefer to have specific goals to outline in addition to that. So there are some that are more complementary than others. And so really breaking it down, when it comes to theory, it's fine. It's more than acceptable. I myself like to utilize, a few different ones based on the kinds of people I'm working with, the kinds of problems, but it's all really housed within the same frame or the same environment, so to speak. And so, when we look at theory, again, there's multiple choices. There's a few options you have, and the ones we're going to talk about are really the main ones. There, of course, I don't know all the theories, but I'm sure that, there's new stuff coming out every day. But for the sake of our space together, I think it's most effective to highlight the main waves, as we call them. So we have wave 1, wave 2, and wave 3. Simply put, wave 1 are the theories that were foundational in the field. These theories really start at Sigmund Freud, and sort of end at, I would say, maybe John B. Watson, behaviorism, right? Because behaviorism, we're shifting more into phase 2. And then phase 2 is really lasting from John B. Watson all the way up to, I would say maybe like the 1970s, 1980s with the feminist movement. Then we get more into feminism, a feminist theory, narrative theory. We're looking at brief solution focused therapy. So fear not, we're going to break these down a little bit more, but just be aware that all theories can really be housed under wave 1, wave 2, or wave 3. And it's not necessarily timeline or date of inception of the theory in which they're housed, but more so it is based on where the theoretical orientation zooms in on. What I mean by that is for the first wave theorists, such as Freud, Jung, Kernberg, and related individuals there, their orientation focus zooms in on being past oriented, right? So easy enough, wave 1 is looking into the past. It is, of course, having therapy today, talking about present day issues and challenges, but always trying to link it back to early life experiences, digging into unconscious processes, examining attachment to early caregivers, and trying to understand our background with that in hopes that it creates insight and assists in managing distress in the present moment. I do identify as a first wave theorist. I really enjoy the first wave theories, being past oriented as an attachment-based counselor. The wave 2 theorists get more into present day, right? So earlier I mentioned that behaviorism, DBT, looking into CBT, cognitive behavioral therapy, dialectical behavioral therapy, classical conditioning, behaviorism in general, those are your second wave theories. These are theories that you're meeting with someone and in the moment you're examining pretty much present day stuff. By present day, we don't mean exactly today, but we mean like within the present moment and the, plus or minus of what that is. It's not placing large emphasis on how you were raised as much as it's looking at yourself in the moment, in the present day, your challenges going on, working within that time frame of the present day, more so than the past. And then the third wave theory, you guessed it, this would be theories that look into the future, being future oriented. This is really targeting more of like a narrative, existential even to a degree, feminist theory. A lot of your postmodern philosophies will fall within the third wave theorist movement, which it examines a lot of empowerment, a lot of resiliency. A lot of counselors in today's day and age endorse being more future oriented and honing in on what we can do to create more peace in our life in hopes that it also impacts the present. It's very communal in a lot of ways too. So we've got our first wave, our second wave, and our third wave. And when we look at all of them, there's really no theory that's better than another. Of course, as clinicians, we're always biased to our preferences. I'm literally writing a position paper right now about how the first wave theory is superior to any other theory when it comes to trauma work. I identify as biased, but I've got support to back up my claim there. And I'd be happy to make a video and share with you guys more about that when I'm finished with it. But like I said earlier, whether you are a counselor who's in school looking into theory, or if you're a client who's curious about getting into therapy, understand that therapy is so much more than just talking about your problems. You want to connect with a therapist who not only listens and understands you and meets you where you are, but also challenges you in the way that you want to be challenged, in the way that you need to be challenged, perhaps. It's more effective to do some research on the front end, call your therapist, interview your therapist if they don't offer free consultations, which most of us do. So, should be pretty easy. You can really dive into exploring all of your options and trying to find one that fits your framework and your worldview. I'll also mention that faith-based counseling is effective for those who choose to pursue it. It's something that I offer to my clients as well, should it be requested. And in terms of where that falls philosophically, it could fall within any of the three dimensions. It's really just an aid, a supportive component, adding in that Christian counseling or faith-based counseling of sorts perspective. So if you're curious of pursuing that, there are formal degree programs in specifically, faith-based counseling. But most of the time, what I see and what I offer, it's more of like a supplementary in addition to the past orientation work that we're doing. So keep that in mind. And yeah, with that said, I'm going to make a separate video shortly going over specifically psychoanalytic theory and psychodynamic theory and how that can show up in actual practice. It's one that I really, really like. So I'm going to take some time on that one. And I would love it if you guys asked any important questions or shared thoughts you have based on this video. Which theory do you find most interesting and what parts of them do you have questions on? Let's journey together. Thank you.